After morning meditation with God, the verse that stuck out with me the most was Jeremiah chapter 9, verse 24. Wasn't sure exactly how it applied today, but I kept it in my mind as much as I could. Typically holidays, it's not as busy as the regular work days, and so I had a little bit more spare time in the morning because I could go into the hospital a little bit later than typical. Just arrived and it looks like the physician parking lot is empty, and typically when that's empty there's not many people working and not many consults are going to come in, so it should be a pretty calm day. I know I have at least one also. Before even I got to see the patient, I met with a student and got her a pair of goggles because they think that the wearing eye protective stuff helps prevent against the transmission of COVID, and the lady gave me a few extra, so I'm gonna go back to the car, drop it off, and then wait to hear back from a medical student who's going to see the patient first, and then we'll discuss the case and see the patient together. So I wonder, some of you might be thinking, why would I have a medical student come in Christmas Eve? Look, it's a 2-week rotation. They missed a few days for going on vacation, so they have to make it up. It's not fair to other classmates if she just gets off the hook. But granted, to her credit, she was very honest about why she was taking days off. So it's probably go home early today. So the first patient just gets agitated at times. They want me to see what I can do with the medications, but really it's just intellectual limitations and poor coping skills. So I'm gonna get easily frustrated when they don't understand things or they don't get what they want. Now I'm on my way to see the next patient for depression. I was asked to see this patient who one of my colleagues saw a few days ago, although I wasn't really feeling up to talking at the time, although he was more willing to talk today, and seems to have a long history of depression, has been doing pretty well for several years, although may have gotten a little bit worse over the last few weeks before he came into the hospital setting. After sending the doctor my recommendations, there was some downtime, so I reviewed some of my emails, and from the medical school they sent out emails, and I got some more responsibilities, which actually I'm really appreciative of. The first one here is helping to form some sort of systematic policy on how to deal with mistreatment of the medical students. And the next one is how to protect essentially their confidentiality if they need medical or mental health care, and to ensure that the people who are helping them don't also teach or directly train them. Then that brought me back to this verse that I contemplated on this morning, where I think that extra responsibility and that stewardship, so to speak, is basically a fruit of my dedication in trying to live a life that's pleasing to God. So I'm going to just take a moment to pause and reflect on that. It's really nice to work with the medical school. I feel like I'm entrusted with this great responsibility, and one, teaching medicine, two, helping other people become physicians. So really don't want to take it for granted. I got to make the most of it. I'm sure there's got to be some sort of joy somewhere, and helping people with depression or patients in acute or hospital settings, although sometimes it's a little bit harder to feel or find. But I'm sure each has its own blessings or characteristics that I try to do faithfully. So as you can see, I'm taking a break. Only had 2 patients so far, 1 new one follow-up, and getting some exercise, some quiet time. We'll see. It's probably gonna be a slow day, so I might go to a nearby coffee shop or something, do some reading, and if I don't get any other messages or asked to see any other consults later. Here are some of the snacks that are complimentary at the hospital for physicians and physicians lounge. This is what I listened to during some of the downtime. Well, I took a little bit of a break, had some coffee, and I got a couple new consults, actually a couple follow-ups. I saw them earlier in the week. So I'm just check up on them, see what I can do to help the situation, and go from there. Made a quick pit stop at the doctor's lounge, and this was on the news in the doctor's lounge about the growing number of sports stars getting honest about mental health. Well, 3 more patients down. I just saw one seemed to be getting confused and altered after they got an injection yesterday morning. They got the injection because they're very restless and pacing, and due to their history of schizophrenia and dementia, not be able to calm down on their own. So they got the injection, but it seemed like they had the side effects where I stopped eating. So just made some recommendations to try and address that issue. Another one with feeling depressed this morning, and that's not uncommon for depression to get worse in the morning. Already been in the hospital for 3 weeks, so increase the depression medications, try and help alleviate that, and hopefully can send him to a psychiatric hospital where he gets more regular psychiatric care. Another follow-up for elderly lady with a history of strokes, urine infection, so going to be easily confused, and they were so disoriented on the interview, can't hold a conversation. So I just added medications as needed in case she starts like pulling out at her IV lines or trying to get out of bed, which would make the situation unsafe for her. Well, it's about 3 o'clock. My shift technically goes till 5. It's unlikely that any more consults will be called in this late in the day, although still want to be prepared in case anything emergent comes, which really unlikely. Also don't want to get any late consults and pass it off to my colleagues tomorrow, especially since tomorrow's Christmas Day. So just gotta hang tight and see what comes up. My shift this morning technically starts at 8 o'clock, although it's about 8:30. I haven't gotten any contacts for patients to see, so I'm going to just take some time to attend the service and just be on standby if anyone contacts me for patients. I have access to electronic medical record remotely, and so in this hospital settings that I'm working at today, patients are typically just placed on the list for a psychiatrist to go and see them. So technically I've been at work for 4.5 hours now, and there was just one patient so far from the 2 hospitals I was called to see. So I called actually the hospital and gave my recommendations. This was a patient I saw yesterday in the ER. He was discharged and came back, and it seems more of like he likes the attention, wants to be in the hospital. There's only so much I can do. But I gave him my recommendations, and still 5.5 hours left in the shift, and see if I get any more consults. This was the verse I tried to contemplate on throughout today, although it wasn't as easy for me to apply as yesterday's verse. So around like 3:20, they put someone on the list. It's really rare that a consult comes in that late. I'm not sure what time it came in, but right now I'm deciding to go see them. It's about 4:15 now, so like a 30-minute drive, but just I can't complain. That's not really the only patient I've asked to see so far, and so we'll see how it goes. So of course I come all this way to see this patient, and she is confused, can't talk, likely confused due to a urine infection, also may have a pneumonia. There's not really much a psychiatrist can do at this point. So just did the Rex, didn't take very long, maybe 15-20 minutes, and called it a day.